You may have heard the saying, doing something is better than doing nothing. But when it comes to medication, that couldn't be further from the truth. Most of us, or someone we know, may have taken leftover pills, over-the-counter remedies, or natural supplements when we feel unwell. It's quick, it's easy, and it feels harmless. But sometimes what feels harmless can actually be dangerous. My credibility related to this topic comes from my health science studies and my research into medication for this presentation. I've taken classes such as microbiology, and during that class, we really delved into viruses and bacteria and how certain things can't be treated. And today I'm going to demonstrate two simple practical tools to help you stay safe. Those include how to read a medication label correctly and how to use a symptom flowchart to decide when it's safe to self-treat and when it's time to seek help. Let's start by understanding what self-medication really is and why it is so common. Imagine this. You wake up with a sore throat, you're busy, you don't want to miss work, and you still have leftover antibiotics from last year, so you take them. You might think it's worked before, and it'll probably work again. That's self-medication. And that can actually be so dangerous because you don't know if those antibiotics have expired, therefore they're not very effective. In addition, it can also cause microbial or antibiotic resistance, which can cause more harm. According to a 2014 study in the Journal of Basic and Clinical Pharmacy, people often self-medicate because it's convenient, cheaper than seeing a doctor, and they believe that over-the-counter means safe. But that assumption could lead to serious consequences. Let's take a look at what can actually go wrong when we treat ourselves without proper guidance. It can actually mask conditions. So according to the Gateway Foundation, when people treat symptoms on their own, you can actually be hiding the underlying causes for those symptoms. Symptoms are essentially the body telling you what it's trying to do to manage the underlying cause. For example, taking painkillers for constant headaches could delay discovering something more serious, like high blood pressure, or it can also result in dangerous drug interactions, such as mixing medications. Even ones that seem harmless can be risky. We're going to delve into this also later into the speech with some photos, but for example, combining two pain relievers that both contain acetaminophen can actually cause liver damage, especially in long-term use. And touching on the topic again, using leftover antibiotics or taking them for viral infection adds to antimicrobial resistance, which is a global health issue, and it makes real infections harder to treat. Examples of this can be something that I touched on also in microbiology, which is C. diff, which is essentially resistance due to prior use of antibiotics in the gut health. So how do we protect ourselves? The answer starts with knowledge, and that means knowing what you're doing. Step one, you have to look at the active ingredient of what you're taking. This tells you what's actually in the medication. For example, Tylenol and NyQuil both contain acetaminophen, and this is right here, the highlighted part. And this tells you this tells you that the active ingredient is acetaminophen, and if you take them together, you could accidentally double your dose and harm your liver. Step two is checking the purpose and uses. Some medications treat multiple symptoms, but that doesn't mean they're the right choice for every kind of pain or illness. Step three is read the warnings. This part lists drug interactions and health conditions that make it unsafe for use. For example, people with high blood pressure should avoid certain cold medicines. And follow the directions. Dosage matters. Taking more doesn't make you better faster. It can actually make you worse. And step 5, note the active ingredients, especially if you have any allergies or sensitivities. This can help you avoid any unnecessary reactions. And according to the FDA, being able to understand a medication label, also called label literacy, is one of the best ways to prevent accidental misuse and overdoses. Now that we know how to check a label, the next question is, should you even be taking medication at all? This will also bring us to our second demonstration, which is a symptom flow chart for safe self-care. Now I'll show you how to use the Mayo Clinic Symptom Checker to help assess your symptoms and guide you toward a safe decision. So right here I have examples of the page of the symptom checker. So first you're going to go onto the site. I have a link right here, and this is step 1. So this pretty much presents a list for adults and children of symptoms, and you kind of pick which resonates most with what you have. So you select your symptoms. So for example, for this symptom, I put cough. And then it'll answer any follow-up questions you have, such as severity, duration, and other associated factors. So for this example, I put the cough is dry and ongoing and recurrent. However, there's a lot more others to select from. And then next, the tool will show you whether your symptom might be mild and manageable at home, or whether you should seek medical care or evaluation. So now we've walked through what self-medication is, what can go wrong, how to read a label, and how to use the Mayo Clinic Symptom Checker as a decision support tool. In conclusion, self-medication may feel convenient, but it carries real risk when done without guidance. Today we covered how self-medication happens and why it's risky, how to read a medication label to protect yourself, and how to use the Mayo Clinic symptom checker to make a safer, informed choice about whether to treat or seek help. So next time you don't feel well, pause. You have a lot of resources online, a lot of trusted resources, and be sure to read the label if you do decide to seek medication to help with your symptoms or your ailments. And if you're still unsure, I believe it is best to ask a healthcare professional, of course. And because sometimes the best decision isn't a pill, it's knowing what to do before you take one. And it's always best to not gamble with your health. And right here I have a list of my references, and thank you today for listening, and have a good day.